A ver.
Tengo una pregunta, no sé si lo dijo porque bueno, pero ¿todas las pacientes pueden ser candidatas a una marcación abdominal?
Is every patient candidate for a high definition liposuction?
I wouldn't say every patient, especially patients who are still on their weight loss journey. What I recommend too, this is a great segue, is that, especially for men, I don't recommend starting off with high definition of the abdomen because that doesn't look natural. Like if a guy goes to the gym, they don't really just focus on their
Yeah.
abs and only their abs, right? If they don't have any upper body or any arm definition, then it looks kind of
But I've
obvious.
seen that, like a really like ripped fake ab and no muscles and like
Yeah,
arms.
yeah, yeah. And that to
It's
me is
true.
like a clear giveaway,
Uh huh.
right? So, what I've started to recommend my male patients is to really do fat grafting to the shoulders so that they have some broad shoulders, and then also do fat grafting to the pecs so that it really looks like they have upper body
Hmm.
definition, because that's typically what most men start out with in the
Yeah.
gym. They do bench press and stuff like that and really build the upper body while building the abs, right? And so I do a procedure where I can do all three at the same time, where I fat graft the deltoids, fat graft the pecs, and then also do high definition liposuction of the abs in order to give you that like fresh out the gym, like,
Yeah.
masculine look.
Does that have like any risk? Like do like fat in here or in the pecs?
So that's a great question. So every surgery has its risks, right? However, with the ultrasound, we can see where the blood supply to these areas are, and so it's infinitely safer with it. I always make sure to use an ultrasound to see where the blood vessels are. And the good thing about these areas are the blood vessels are not as big as the ones in the buttocks, for
Mm-hmm.
example, where you hear about the complications, embolism, or the fat goes into those vessels, and it can even result in deaths, unfortunately. However, whenever you use an ultrasound, the risk of that happening is super duper low. Like they've done anatomical studies or cadaver studies
Mm-hmm.
where they use an ultrasound and no fat goes below the muscle as long as you can see where the tip of the
Yeah.
cannula is.